one first. Just as the beginning is just kind of an overview of home and community-based services and, you know, where we fit in the state of Kansas. So we're in the Long-Term Services and Supports Commission at KDADS. And then, yes, HCBS stands for Home and Community-Based Services. So basically what that means is we want to keep people in their home and in their communities. And it does also help people avoid institutions. And so here we've listed out our 7, soon to be 8 waivers that we have in the state of Kansas. And so I'm over the IDD waiver, which is intellectually developmental disabled. And we do have a wait list, which is partially why we're developing the last one, the community supports waiver. And we serve people that have an intellectual developmental disability. The SED waiver, which that's a severe emotional disturbance waiver, and that's the CMHCs or the mental health centers are the ones that kind of provide most of the services on that waiver. Got the TA waiver, technology assistance, the brain injury waiver or BI waiver, PD waiver, physically disabled, which also has a wait list of about a year, but I think they're working on decreasing that. Frail and elderly waiver, and the autism waiver, which has a proposed recipient list, and then the community supports waiver, which is being developed. Okay, so KDHE and KDADS work together on waivers. Kansas Department of Health and Environment is what KDHE stands for, and KDADS is Kansas Department of Aging and Disability Services. So KDHE holds the contract with the managed care organizations or the MCOs, and those currently are Healthy Blue, Sunflower, and United Healthcare. They hold the contract with MCOs and CMS, which is our federal government. To be on a waiver, one must also be eligible on Medicaid. And KDHE is who handles the Medicaid application process and that financial piece. It can be confusing, but one can be program eligible, which is kind of what we're talking about, the program, but not Medicaid eligible, and vice versa. One needs to be eligible for both to be active on the waivers. And then here's kind of an introduction of my team. So I'm Robin Lohman. Letha Farwell is actually the program manager. So she works a lot more closely with providers and the CDDOs and crisis and other exceptions. Jason's our eligibility specialist, and he works on eligibility to get on the IDD waiver. And then Erin Norris, she's actually in a different commission, but she does licensing over the IDD's community service providers, which is who provides the direct supports to individuals on the waiver. And then Caitlin England is our program integrity compliance. So she works a lot with abuse, neglect, and exploitation reports, and also works with the CDDOs. And the CDDO is where people get determined eligible for the IDD waiver. Okay, and this is just an overview of being eligible for the IDD waiver. So it's 5 and older who meet the definition of intellectual disability, have a developmental disability, or are eligible for care in an intermediate care facility, or an ICF, for individuals with intellectual disabilities. Those with developmental disability are eligible if the disability was present before age 22 and there is substantial limitation on 3 or more areas of life functioning. And then just an itemized eligibility list, you know, be 5 years old, be diagnosed with ID, intellectual disability before the age of 18, or developmental disability diagnosis that began before 22. Program eligibility, such as diagnostic documentation and a review of substantial life limitations, meet Medicaid long-term care institutional thresholds, or that's the functional assessment. You might have heard that referred to as a BASIS, but we are transitioning from the BASIS level of care assessment to the MEFI. And then you also need to be financially eligible for Medicaid through KDHE. Okay, where to begin? So my answer is always going to be the CDDO, the Community Developmental Disability Organization. They're your first stop shop on how to get started. There's 27 CDDO areas in the state of Kansas. They're in catchment areas, much like the CMHCs, except for this is for the IDD waiver. And that's what they're the assessing entity for the IDD waiver. So the CDDO will help guide you through the process of becoming system eligible. They'll need diagnostic documentations. Sometimes there's an additional assessment that's called an EDI, or I think it's eligibility determination instrument. But if you get like some diagnostic paperwork that doesn't have a very strong psych evaluation, or maybe not one at all, maybe it's just a genetic diagnosis, then they'll do this extra assessment. And this is not an exhaustive list of diagnoses, but they can include intellectual disability that's usually associated with an IQ score, but not exclusively. Autism, seizure disorder, cerebral palsy, Down syndrome, Prader-Willi, and Rett syndrome. Okay, so then after, if a person is determined system eligible, then the next step is to do the level of care assessment. And that is completed to determine the function eligibility, which also means you're waiver eligible. Currently, the level of care, or LOC, is the basis, but is being replaced by the MAFI. With KDAD's final approval, and depending on the request circumstances, the person is then put on the IDD waitlist. Okay, and this is just a listing of IDD services. I think further down on the slides, we have more descriptions of them all. But I think, if I'm thinking right, you guys mostly interact with children that might cross over to the IDD waitlist. So that's going to be PCS, residential supports for children, or children's residential, and there's like home environmental modifications and some of the others as well. But usually the adult day supports and adult residential support, those are obviously for adults, so you probably won't see too many of those. And then a quick note on targeted case management. Oh, forget my slides. Thank you, Kathy. So it's kind of interesting to think about, but targeted case management is not a waiver service, so it's available once you're found eligible for IDD services. If you are not KCART eligible, or which is like Medicaid, then there may be a fee for service. A lot of times TCM providers will have like a sliding scale, or you can just do an outright private pay. The TCMs are the ones who write the person-centered support plan. It's an annual plan that helps the person develop their life and the supports that they need. The services they provide include an assessment, support planning, monitoring and follow-up, and referrals. And one can get TCM if determined system eligible, even if under 5. Okay, residential supports. I'm not going to read this verbatim, but basically, currently residential supports is just a 24/7 support. So it helps a person live in their own home. Many times we see individuals living in what they call a group home. So they've got 5 or 6 roommates, and they're staffed overnight. There's some individuals that actually live on their own, and then staff may stop in once a day, or maybe they just need a few hours, or maybe just overnight support. So there's a lot of different variations of residential supports. Day supports, just to help individuals who are no longer eligible for school services maintain or increase ability, productivity, independence, integration, and community participation. So really this is kind of getting them out into the community, actually integrated into the community. And there's sometimes there's also like job supports, employment supports, things like that. Examples include community outings like movies, attending a day center program, and then again, work on skill development or volunteering. And we are actually unbundling these this summer. KPCS, some of you may be familiar with that. Personal care services is offered on other waivers too. And like that, it's on the IDD waiver. Provides supervision and/or physical assistance with instrumental activities of daily living and activities of daily living, health maintenance activities, and in some cases, socialization and recreation. And generally, we do see this support delivered in a family home. And the financial management service, or the FMS provider, that's who does the payroll service. And they can also offer support in training and employer orientation and things like that. So when you have personal care service, if it's self-directed, that means like the person or the guardian finds the worker, trains them, establishes a schedule and all those things. And the financial service is who does the payroll and who offers some kind of behind the scenes support for that PCS worker. Wellness monitoring, this is generally for adults as well. You don't see it too much, but basically it's a registered nurse evaluates the level of wellness every 60 days. They look for those itemized supports there: orientation, edema, skin characteristics, personal hygiene, blood pressure, respiration, pulse, and any adjustments to medication. Children's residential, provides placement for children from 5 to 21 in a licensed foster care home in order to avoid placement in an institution or other congregate settings when they can't remain in their family home. So this is for non-foster care children, and it is a voluntary placement. And Kansas has very few providers, and we would love to have more. Overnight respite is a service that provides temporary direct care and supervision of the person in order to provide relief to the primary caregivers and the family. Can be used for periods of relief for vacations, holidays, and other scheduled times off. And it's provided in planned segments. Supported employment are ongoing support services for IDD participants to allow them to engage in competitive work. Competitive work is defined as work for which an individual is paid in accordance with the fair labor standards. Competitive integrated employment, which can include work outside of the home or work in a home environment. When day services is unbundled, the service will be known as individual employment services. So like a sheltered workshop, you guys might have heard that term, sheltered workshop would not be a qualifier for supportive employment because that's not integrated or competitive. Okay, Children's Integrated Community Supports is actually a new service that we added. This was kind of in response to, there was some kind of summer camps, I think they were in Wichita, and they were doing group PCS work. And so it's not the exact same language, but essentially it's kind of group PCS work for children. So Children's Integrated Community Supports is designed to provide group-based supports and supervision for school-aged participants with IDD, children from 5 years old to school-leaving age with IDD. The service offers a support system for families where standard childcare options are not sufficient to their children's unique developmental needs, while allowing an opportunity for integrated care for non-disabled child peers. Specialized medical care for those with intensive medical needs can only be met by an RN or an LPN under the supervision of an RN. Includes long-term nursing supports for medically fragile and technology-dependent participants. Enhanced care services provides sleep support to provide immediate supervision or physical assistance with tasks such as toileting, transferring, mobility, and medication reminders as needed, or to contact a doctor, hospital, or medical professional if there is an emergency. Vehicle modification services, just like it sounds, adaptations or alterations to a vehicle that is the participant's primary means of transportation, so like a wheelchair lift and things like that. Home and environmental modification services, again, much like it sounds, physical modifications to the participant's home based on an assessment designed to support the participant's efforts to function with greater independence and create a safer, healthier environment. So that could be like a shower, doorway, stuff like that. Medical alert, they used to call it personal emergency response system, or PERS, and that's the button you can push if you fall. The medical alert device is a small instrument carried or worn by the participant, which by the push of a button, dials a responder. Specialized medical equipment and supplies specified in the person-centered plan to help increase someone's ability to perform activities of daily living, improve communication needed for life support, or to address physical conditions. Okay, exceptions to the waitlist. So this one's kind of, and I can provide additional information if you need to, but your CDDO or MCO would help guide you through this step, through these steps. So if a person were to be on the wait list but something came up and they needed supports immediately, these are the lists of exceptions to the wait list so they can get directly onto the waiver. Supportive employment, risk of DCF custody. If they're in DCF custody, there's an option for them to get waiver if they so choose. And then a release of custody for the DCF custody releases. Military inclusion, institutional transitions, so that can include PRTF or psychiatric residential treatment facilities, the Work Steps program, and then there's waiver transitions from the BI, the autism, and the TA waiver, and then of course crisis exceptions as well. And then this is just a quick list of unbundling of day services. So currently everything's billed under either day services or supportive employment, where we're going to just unbundle them and create different services. Okay, and then just a quick note, person-centered support plan. This is the plan the TCM drafts, follows Article 63 regulation and uses a state-approved template. But the person-centered service plan is the plan that the MCO's care coordinator drafts. The support plan is considered a part of the service plan and is under federal regulation, including CFR 441-301. This plan used to be called the Integrated Service Plan or the ISP. Yes, it gets confusing. Okay, and then here's just some links. You guys are welcome to click on later. And now I'm going to turn it over to Sam. Thanks,
All right, thank
everybody.
you, Robin. All right. Hello, my name is Sam Philbern. I am the SED Program Manager, and I will be going over a description of our SED, or Serious Emotional Disturbance Waiver. Next slide, please. So the Serious Emotional Disturbance Waiver here, it provides children with some mental health conditions and special intensive support to help them remain in their homes and communities. The term serious emotional disturbance refers to a diagnosed mental health condition that substantially disrupts a child's ability to function either socially, academically, and or emotionally. Parents and children are actively involved in planning for all of these services. So when we look at eligibility for the SED waiver, typically a child has to be between the ages of 4 and 18 years old. They have to have a diagnosed mental health condition which substantially disrupts the ability to function socially, academically, and or emotionally. So they do have to have an SED diagnosis. They must be at risk of inpatient psychiatric treatment. And then they must meet the CAFS assessment and CBCL thresholds for eligibility. And finally, they do also have to be financially eligible for Medicaid. When we talk about financial eligibility for Medicaid, though, for the SED waiver, since we are typically dealing with children or those that do not have an income, it's very rare that we find a child that is not financially eligible for the SED waiver. I do have a few little asterisks there for the age and for the assessments, just because of the fact that we do have exception requests that can be requested for those as well. So as we break into eligibility a little bit further here, when we look at the assessments, we have the Child and Adolescent Functional Assessment Scale, or the CAFAS. So this one is a tool that is completed by the clinician or a licensed therapist and has a range of scores that look at the day-to-day functioning due to emotional, behavioral, psychological, psychiatric, and or substance abuse issues. For the SED waiver, we do require that the child or youth receive an overall score of 100 or two subscores of 30. And then our secondary assessment that we utilize for the SED waiver is the child behavior checklist. There are a few other versions of this as well, including the teacher report and the youth self report, as well as the adult behavioral checklist, depending on the age of the individual and what we're looking at here for the waiver itself. But very similar to the CAFA scale, the child behavioral checklist looks at the child's behaviors in different areas of their life and assigns them a score that we can use then to qualify for the waiver. For the CBCL, we look for a minimum score of 70 on any one of the three subscales, but they can request an exception for subscales that score between 63 and 69, just simply because these are completed by individuals within the family or within the community of the youth. And so occasionally we do get underreporting based on the idea of wanting the child to appear to look a little bit better on their assessments. So when we look at exception requests, or we talk about exception requests, like I mentioned previously, we have two different exceptions. We have the age exception and the CBCL exception. For the age exception, that actually falls further into two separate age exception possibilities there. The first one is the minimum age exception. So children under the age of 4 who have a need for SED waiver services, typically looking at those that are 3 years old or about to turn 4 that are needing those services to be put in place as soon as possible. So we all know that, especially for children and children's mental health concerns, that the earlier we can get intervention, the better that the outcomes typically are for those kinds of interventions. We also have a maximum age exception. Those are for youth that are over the age of 18 and still continue to meet the clinical criteria for the SED waiver. We have two different portions there. We have the initial or ongoing age exceptions for the maximum age. If we're looking at an initial age exception, the individual must still meet all the requirements for the SED waiver, and they must also have been participating in services within the community at 6 months prior to turning 18. If they were not participating in those services, they have to have some reason for not being able to participate. That could be incarceration, it could be institutional living, things along those lines that would keep them from being able to participate in those community services. The ongoing waiver access is as long as it is prior to the individual's 19th birthday. or at their level of care assessment, the participant may continue on the SED waiver if found eligible to continue by the qualified mental health professional up into their 22nd birthday. So that does allow us to give a little bit more wiggle room there into the older youth as they transition from childhood to adulthood. For the CBCL exception, we do allow the CBCL subscore that is not quite at that 70 mark to have an exception request. They have to fall between 63 and 69 on any one of the three subcategories there. This also does require an explanation of why the CBCL minimum score criteria should be accepted. For example, we describe circumstances that interfere with attaining the minimum CBCL score or clinical observations that support the exception of the minimum score. Like I had mentioned previously, a lot of times these would be issues of potential underreporting or, a child being new to a foster home. And so the family maybe not having the full history of what the child is like or what the behaviors are like. So in those kinds of situations, we do take that to effect when we look at exception requests for the CBCL. So when we want to look at SED waiver services, we have different services here available specifically to the waiver. So we look at parent support and training. It's exactly what it sounds like. It provides additional support to parents of children that have the SED diagnosis and are currently on the waiver. A lot of community mental health centers that supply this service will use peer-to-peer parent support training. So it is another parent that has experience with a child with SED waiver or may even have a child currently on the waiver and has experience working through that system. We have independent living and skills building. This is often utilized for those older youth, generally starting around the age of 14 or older, and that looks at helping set the child up to be independent and learning how to live independently outside of a system that has more of the structure and regulation to it. So it can be anything from employment, helping to maintain or obtain employment, housing, education, community life, anything that would assist with transitioning to that adulthood there. We have short-term respite care, which is just set up to be a break for both the youth and the family. This can be provided in a few different ways, including in the community, within the home, and then some of the community mental health centers will even have a respite center set up where the child can actually go and stay overnight or for a period of time and actually get that break for both them and their family. We have wraparound facilitation on the SED waiver. This is kind of the crux or the big service that is utilized very frequently on the SED waiver. This is very similar to targeted case management, but it does offer a unique need. A unique look at the needs of the participant. So, wraparound facilitation can actually bring in individuals that are not commonly found in targeted case management meetings, such as outside providers, teachers, if the individual has a therapist that is not part of the community mental health center, they can be involved in the wraparound meeting. So it really is what the youth or family deems as being necessary for having at those wraparound facilitation meetings. We also have professional resource family care. This is a very small service on the waiver, but it is designed to be a short term intensive support to a person in a surrogate family setting. So, what that means is the child would actually go and live in a licensed foster home, but still be in custody of their original family. And so, the original family and foster home would work in tandem to co parent the individual through this service. This one, like I mentioned, is relatively underutilized, or just honestly, there's not a lot of providers available to be utilized, and simply because they are also licensed foster homes. So oftentimes they do have foster children that they are assisting with or that are living in the home outside of this service. And then SED waiver also has attendant care. Attendant care is designed to help support those therapy services that are being utilized for the individual to help them be within their community. So these can be done in the community, the home. They can also be completed in the education setting or school settings. They cannot be educational in nature though, so they do have to work more towards the mental health side of things. So, working with the individual or the youth to help them work through any kind of behavioral issues that may arise throughout their day, to help them with their coping skills, to help cue them throughout completing the tasks as needed without it being educational in nature. The SED waiver does also have targeted case management, and like the IDD waiver, it is not a waiver service, but it is offered to individuals on the waiver. So this instance of targeted case management is specific to mental health. So the individual or youth must have an SED diagnosis in order to qualify for the targeted case management mental health service. So as you can see there, it's more mental health in nature and work towards assisting in that aspect as well. So this is not a waiver service, but it is available to youth with an SED diagnosis. How to apply for the SED waiver. So the SED waiver, the state of Kansas currently contracts with the community mental health centers to complete the SED waiver process. So that you would need to contact your local community mental health center or CMHC there. Each CMHC varies slightly in their service delivery and options. So please contact your local CMHC for further information. I have included here a list of directory of mental health resources in Kansas. So this does include all of the CMHCs that are throughout the state and which counties that they cover for their catchment areas. You will see a lot of times that these are now called CCBHCs, but every community mental health center in Kansas became a CCBHC, so they are still available there and able to offer the same options as they were before with some increased possibilities. And then this is just additional contact information for KDADS and for myself. So that is a brief overview of the SED waiver in a nutshell. I'm now going to turn it over to Kathy Keck for the TA waiver.
Good afternoon. Right after lunch presentation. They're always tough. All right. So my name is Kathy Keck, and I am the program manager for the Technology Assistance Program, and Jasper Lumide is the eligibility specialist. So I'm just going to kind of go over the intended purpose of the TA waiver, the definitions, the criteria, how you access it, and then the services available, much like my colleagues. So the purpose of the TA waiver is really to care for participants who would have been routinely hospitalized or at intimate risk of being hospitalized, or whose illness or disabilities in the absence of home care services would require admission to prolonged stays in the hospital. There's about 850 kiddos across the state on the TA waiver, and this waiver is really for those kiddos with really high complex medical needs that require that medical technology basically to survive. So again, the waiver serves technology-assisted and medically fragile individuals between the ages of birth through 21 who are chronically ill or medically fragile, so dependent on a ventilator, some sort of medical device to compensate for vital body function, and require some substantial and ongoing daily care from a nurse. So really, the TA waiver, when you think of it, these kids, the care they receive at home is really comparable to that of what they would receive in a hospital setting in order to avert death or further disability. And just a little note, that cute little girl there is my daughter. All right, so to be functionally eligible, you have to be functionally eligible and financially eligible, just like my colleagues have said for the other waivers. And again, as Sam nicely had pointed out, that, because most of the kids or the individuals on this waiver are children don't usually have a whole bunch of assets. And the financial eligibility is off of the child's income. So again, kind of just a rundown, between 0 and 21 years of age, they have to meet the program definition, and they have to require one or more identified primary medical technologies, and also meet the minimum technology score for their specified age group. So for children entering on this waiver, we have some assessors in the state. They're called Matlock assessors, and they do a medical evaluation of all the kids, and the children have to receive a minimum threshold for each specific age group. So any kiddo that is between 0 and 21 years of age that has a minimum technology points of 50 is automatically eligible for the waiver for the functional eligibility. So these are kids, to get a 50, just to give you an idea, these are usually kids that have probably a G-tube and a tracheostomy. If they have at least those two technologies, pretty much going to guarantee that they're going to qualify for this waiver. But if they're between the ages of 0 and 5, they can have a minimal technology score of 25 points and also a nursing acuity score of 20 points. Or when they get a little bit older, from 6 to 21, they can have the minimal technology points of 25 and an acuity points of 30. So for people to see if they're eligible, the process begins with our contractor. It's called Family Waiver Care. So they would either email or call them and request to have a medical assistive technology level of care, or MATLOC, assessment completed. The MATLOC assessor, they'll advise the parents to apply for Medicare, not Medicare, Medicaid and KCART if the child is not already enrolled. And then the assessor will provide information and support the family to complete the online application for a medical card. And then after that, these assessments, they can occur while the child is still hospitalized. However, the services obviously won't begin until the child is discharged, but having them ready to go, boots on the ground from leaving the hospital to move into their family home is very critical for some of these kids that have some pretty intense medical needs. So again, to be financially eligible, individuals have to apply for KCART, and I have the link listed down here actually is a link directly to the KCART application and instructions. I don't know about any of you, but sometimes it's helpful to see what this infamous app looks like. And so I just wanted to include it here so you could go and look at it. So when you're instructing families, or if you're working with families and advising them to apply for KCART, you can see it yourself too and some of the questions that they ask. An important thing on the application is that there's a checkbox that will say for elderly and disabled, and select the HCBS box. So those are important things on that application. And you can either mail or fax the application if you don't do it online. All right, so there's 7 services on the TA waiver currently, and some of those are more utilized than others. And so as we go through them, I will talk about them. So I just kind of have them listed, but I'm going to skim through these and because I'm going to go over each of them specifically. So specialized medical care, it's probably the #1 used service on the waiver. So what this does is it provides a nurse, an LPN, or an RN to come into the family home to help care for that child. Again, if we think back to the definition and the purpose of this waiver, it's really to provide the hospital level of care for kiddos in their home. And so this service makes sense, providing a nurse in the home to help with everything the child may need from day to day. And the nurse can go wherever the child would usually go in the community, to doctor appointments, physical therapy appointments, on play dates, wherever the child is, the nurse can go with them. So again, this service is provided by a registered nurse or an LPN under the supervision of an RN. And then they're trained with the medical skills necessary to care for the kids and meet their individual needs. And the level of service is determined by the MATLOC assessment. And then it is the responsibility of the provider to ensure that there are appropriate levels of nursing is employed. And so not all nurses during nursing school have long clinicals on what to do with a trach or a ventilator. And so sometimes those nursing agencies have to provide additional training to their nurses if they're sending them to a home that has that level of technology. And then if the provider agency is unable to provide the necessary medical needs, they really should be collaborating with the MCO to ensure that barriers are removed to meet those medical needs. Services for this waiver. So if there's 2 children in a home that are both on the TA, one nurse may provide specialized medical care for up to 2 participants, related or unrelated, and living in the same home, as long as both participants are served by the same MCO. If more than one TA recipient resides in the same home and the level of cares cannot be met by a personal care attendant, then the MCO must meet the level of care need appropriate. And of course, specialized medical care is not supposed to duplicate any other Medicaid state's plan service that's being offered to the family or that the individual needs. Just a little bit more about specialized medical care. So participants who are eligible to receive EPSDT may access those services through the Medicaid state plan. All right, so Robin, I know, did a good job going over the fiscal management service yesterday, and if I were to redo my slides, I would probably put PCS service first. So fiscal management services is really a service to participants to help them exercise employer authority for self-direction under an HCBS program. And like Robin had already talked about, they do the payroll, they can help with that, you know, the hiring, the initial hiring of a staff. And this service is always used in combination with either agency-based or self-directed, I'm sorry, excuse me, not agency, self-directed PCS service. So the FMS provider operates as either a vendor fiscal or employer agent under, and you can see the IRS code. I won't read that to you. Another service on the home is home modifications, and this is pretty critical service for kids on the TA waiver, because as we've already kind of went through the definition of what kids on this waiver may look like, you could imagine a lot of them might have a lot of needs to help fix up their home. So home modification really is to modify their home. It needs to be identified as necessary to assist them in day-to-day functioning and indicated in their person-centered support plan. And really it's meant to help participants to have the most independence, mobility, and maintain their productivity in the community. So this just talks about a few things that might be offered under home modification. So a person transfer lift, installation of a ramp, widening of doors, modifying a bathroom, and all of the things. The caveat with the this service under the TA waiver is there is currently a $10,000 cap on this service. Now, oftentimes the MCOs will work with the family to help meet those needs, but there is currently a $10,000 cap on this service. All right, so we talked about PCS services. It's a service offered in many of the different waivers that we have in our state. So this is that one-on-one individualized service provided during times when the participant is not typically sleeping, and it can either be self-directed or agency-directed, although there's not a lot of agency-directed PCS for this population for sure. So most of the PCS we see would be self-directed by the family. The hours are determined usually by the MCO related to the ADLs and IDLs, which are provided to the participant when they are awake. Due to this population, there are exceptions that can be made to ensure that the health and safety of the participant is met through this service. So again, we kind of talked about all this. So another service that we have on the waiver is called health maintenance monitoring. And this was intended to be with agency or self-directed attendant care, to have a nurse be able to go out and make sure the medical needs are being met by a non-licensed agency who are self-directing. I have discovered recently this service isn't highly utilized, but it is available. So this service would go out and they would provide a healthcare assessment, vital signs, just making sure medication administration is going well, and just overall making sure that the medical aspect of the PCA care is going well. And then the the person that goes out, they would consult with the parent, the participant, legal guardian when they do their assessment, and then those findings would be reported back to the MCO care coordinator. So that's a little bit about health maintenance monitoring. Another service that's on the waiver, not highly utilized, but is still available. It's called intermittent intensive medical care. And this is really designed to meet some intermittent skilled nursing needs. Oftentimes this was coupled when somebody was doing PCS service. And so the things that can be done during this, it's up to 4 hours of nursing. So if a person needs a PICC line accessed, or they're getting chemotherapy, or they're getting some sort of invasive procedure that's typically done by a nurse, I have a list here. So these are the things that a nurse could go out and do. So the IV therapy, the TPN, blood product administration. So if somebody's needing a unit of blood, IV pain control for less than 4 hours a day. So you can see all the things that would be offered under this service. And then also, like many of the waivers, we have respite. This is meant to be medical respite. And so this is supposed to be intermittent and short term, and it must be provided either by an LPN or an RN. And then there's a maximum of 7 days or 168 hours for this service per calendar year. The service, again, is available, but often underutilized. And probably one of the reasons, especially for this population, is that, sometimes it's hard to find just a regular nurse for families, let alone somebody to come in and do this medical respite. But it is available and is something that we're working on improving how we can offer that more efficiently throughout the state. All right, and that's it. I've got questions. I have these links. We'll go to KDADS website, our KCART Ombudsman, and also the KCART website. And so I will turn it back over to Jason.
And if you want to, sorry, thank you, Kathy, for that. If you want to unshare your screen real quick, then I can go ahead and share the case presentation. And then we'll go into a Q&A.
If you could just give me a little pointer on how to unshare now that I've shared.
So I think it might now be at the top of, yep, it switches from the bottom to the top.
It does. Thank you. Sorry about that.
Of course, no worries. All right, now let's find mine. Okay. Do you see my screen with the slides? Okay, first, does it say the case study?
Yes.
Okay.
Yes.
For some reason, it is not showing up on mine, but no worries. Okay. So here is kind of the kind of structure of the case presentation and discussion. So I will be your case presenter today. So I'll review some information about this kind of hypothetical case, and then the participants or the ECHO community will ask any clarifying questions, as well as offer recommendations to the presenters about the topic. And then the presenters, or I will then provide recommendations to you guys based off of that case. So I will go ahead and read through it, and then you all feel free to discuss amongst yourselves on what you think might be best going forward, and then we can go into a Q&A. All right, so Mia is a 5-year-old girl who has been exhibiting significant emotional and behavioral challenges. She has been diagnosed with an anxiety disorder and exhibits signs of oppositional defiant disorder, or ODD. Her symptoms include frequent temper tantrums, refusal to participate in group activities, and difficulty forming peer relationships. These behaviors have led her to being frequently sent home from preschool and have strained her family's ability to manage daily routines. Mia's parents have sought various interventions, including individual therapy and behavioral support, but have found limited resources tailored to her age group. Her parents are concerned about her future academic and social development if appropriate support is not provided. How can the family be directed to HCBS waiver services, and how can these services help this family? And so feel free to discuss your input. There's no wrong answers. There might be, but just kidding. Does anyone have any guesses on maybe what waiver might be best for this
SCD.
situation?
SCD.
All right, so someone said SCD. Do you want to share why maybe?
Most of this appears to be behavior, and she has been diagnosed with at least 2 mental health related disorders.
Yes, very, very good points. And then Mary also said, I think said SEL, but did you mean SED by chance? And then they could help with family and possibly attendance services. Michelle says their mental health organization for the SED waiver. Suk Young also says that she agrees the SED waiver. Do any of the presenters have any comments about this hypothetical scenario, and if you agree or disagree with these answers?
Hi, this is Sam, and yes, I do agree with these answers. I would agree that this would be a great starting point would be the SED waiver services. So funneling this family towards the community mental health center so they could take a look at if the child would qualify for the waiver or not and what kind of services they could offer to assist with these concerns.
Awesome. Thank you for that input. And thank you guys for your participation. Sometimes we don't always have the answers are people don't always find the answers as easily to the case presentations as this one. So good job everyone for paying attention and participating. So does anyone have any questions for our presenters today about these waiver services or anything related to the presentation? Feel free to unmute or ask or type something in the chat.
Are there plans to increase options for respite for children on the waiver, especially those who don't live in metro areas? And what does that look like?
So for the SED waiver, when we talk about respite care, I mean, we're facing, the same kind of concerns and shortage for staffing as everyone else is in the United States right now. So it's really is a difficult process right now to get more providers and to increase that. We do have the managed care organizations working to increase their provider pools that they have and the individuals that they have available to provide those services. So we are really leaning towards that with the contract that we have with them to help increase just overall HCBS services and options that are available, including in those rural areas. So while that isn't a direct answer, I don't have a direct approach from my perspective, at least, about how they're working on that. So I don't know if Robin or Kathy, if you guys want to add anything to that. But right now we are working with the managed care organizations to help increase our provider pools.
I just concur with what Sam says, really working with the MCOs to improve that capacity, probably among all waivers for that respite care option.
And then we have a couple questions in the chat. So Suk Young says, would you please give an example of a crisis situation for the IDD waiver in regard to the waitlist exemption?
Yeah, crisis situation we encounter probably predominantly is maybe an aging caregiver or someone has died unexpectedly. And so then there's like no support. That's, I think, generally what we see the most of.
And then Mary says, is there anywhere we can get this type of information to share with families through the school system?
If you're referring to just the waiver information in general, we do have the access guides available for all of the waivers on our KDADS website. I believe one of us included a link to the access guides in our lists of information here, and it gives a brief description of what the waivers are and what services they offer, as well as directs individuals to where they can go to start that process for the waivers. And I will also post it in our chat here so that you have it, just in case we didn't include it in our slideshow.
I will also send a copy of the presentation slides to everyone that registered. And if there's any additional resources that you three would want me to include in that, feel free to send me that send that to me, and then I'll send it out to everyone else as well. And then it looks like we have another question. For children with both an IDD and mental/behavioral health concerns, anecdotally, these families seem to be falling through the cracks. Are CMHCs required to screen children for a mental health diagnosis who also has autism or is nonverbal if the parent requests it, or are they allowed to turn away children in their area based on autism diagnosis or limited verbal skills?
I don't know if I'm gonna attempt with someone might be correcting me and stuff like that, but my understanding, start off with my understanding, because the CMHCs really aren't my purview, and I acknowledge there's a lot of we need to do a better job of bridging the CMHCs and the IDD community, in my opinion. So as far as I know, CMHCs are not required to just do an automatic screening for mental health condition if there's a diagnosis of autism. They might also do that, but I probably do it upon the request, but I'm not really sure. But I will acknowledge that autism and IDD mental health diagnosis present differently in that population. And I think that there is specialized training that CMHC's providers can do to be able to more readily identify how those psychiatric diagnoses present in this population. But I do not know how well known that is or how prevalent it is out in that field. As far as them being able to turn away, I don't believe they are, I don't think it's legal for them to be able to turn away people based on a diagnosis. But I will say I've heard anecdotally that, I'm trying to phrase this appropriately, you know, like how a lot of times you'll need to have goals and then you'll have to show progress on those goals. And so at certain times, maybe the goals need to be looked at. And then with the historical background on that individual and provide that information to the CMHC so they can better assess the situation and help work on goals. Because I think, again, anecdotally, especially with like a nonverbal person, I mean, how do you work on establishing goals? Especially with a CMHC provider that may not have the background in this population. And so it winds up being challenging. I don't feel like I did a very good job of answering that question because it's very, very complicated and I'm not an expert. So I'm just going to pause and hope maybe someone could either correct me or offer any additional information.
Yeah, Robin, I think the information you gave there is correct. That especially with the community mental health centers becoming the CCBHCs, part of their new contract requirement is that they not turn individuals away that are seeking services. Now they may do the testing, or they may speak to the individual and find out they might not be the most appropriate spot for services for the person, but they would still be responsible for assisting in either making referrals or doing something along those lines to get them to the right place.
And I was going to say, if you guys have any issues out there with CMHCs doing that, I don't want to volunteer Sam on that one, but you could reach out to me and I could get you to the right place.
Yeah, we would definitely want to involve our behavioral health side of KDADS for issues in that regard.